All right. How are you doing today, Terry?
I'm doing good. How about you?
Good. Thank you very much. Would you like to?
Yes. Thank you.
And we want to thank you again for doing this head-to-toe assessment for me for one of my class
Sure.
that I have to submit. And you already signed the consent form.
Yes.
And I did submit that to my instructor.
Yep.
Okay. So how are you feeling today?
Good.
Good. Are you in any pain?
No.
No. Okay. Do you know what day of the week it is?
It is the 7th of February. Oh, the day of the week? It's
The day
Tuesday.
of the week. Today is Tuesday.
Yep.
Do you know what date it is?
It is the 7th of
Do
February.
you know who is the president?
President Biden.
And
Almost
who
said
is
Obama.
who is the vice president?
Kamala Harris.
Okay. Could you tell me your name and your date of birth?
Terry Cormier. And my date of birth is 7/2/55.
Excellent. Good, good. So before I begin, I'm going to go ahead and do your vital signs. And then my head-to-toe assessment, I'm going to start from your head. Of course, it's a head-to-toe. And work my way down, okay?
Okay.
All right. Could you stretch your hand out for me? Good. Okay. Good. Your blood pressure is 110/70.
Thank you.
So while I'm here, sitting here doing your vital signs, I am going to go ahead and ask you to put this underneath your tongue for me. And when it's beep, then you can remove it. And while you're doing that, I'm going to get your heart rate, okay? Okay, your heart rate is 65 and your temperature is 98.2. Good. Just breathe normally for me. I'm going to take your respiration, okay? Respiration is 16. Okay. Okay. So what I am going to do next, I'm going to start with my head-to-toe assessment. And like I said, I'm going to start from your head. And I'm going to go all the way down, okay?
Yep.
So what I'm looking for in your scalp here is to see if there is any lesions, or any cut, any bruises, to make sure that everything is intact here. Okay? I'm going to take a look at your ears as well. It's fine. Your ears look pretty good. You don't use no hearing aid or anything?
No.
So I would say your hair is evenly distributed and it's kind of a little bit, I would say, fine.
Okay.
Okay? If I whisper, could you, I'm gonna whisper something to you that's kind of like a hearing test
Yeah.
to see how accurate your hearing is.
Mm-hmm. Ice cream.
Ice cream. Okay, good. That's good that you hear ice cream, right? I'm gonna take the light. I'm gonna shine the light in your eyes. Okay, I want you to follow the light with your eyes. Do not move your head. Okay, I'm gonna take a look at your ears here. Alright. Take a look at your ears here. There's no discharge, everything is patent right here. Let me take a look at your nose. I'm gonna open your nose a little bit. So your nose is nice and pink. Could you open your mouth for me? Could you stretch your tongue out and say ah?
Ah.
Okay, your uvula is fine. Could you open your mouth again? Could you clench your teeth? Could you give me a big smile? Good, good. Could you close your eyes one more time? Don't let me open it. Close them, keep them closed. Good, so the muscles, they are all intact. Do it again. Close, good. So I'm gonna press on your jaw right here.
Mm-hmm.
I want you to open your mouth wide and say ah. Good, I do it again. Ah. Excellent. Good. Your mandibular muscles and joint is intact and pretty strong. Could you open your mouth for me one more time? Stretch your tongue out. Could you wiggle your tongue left to right and up and down? Good. How's your teeth? Do you have dentures?
No.
No? Teeth is intact?
Yes.
Good. Excellent. Could you move this? So what I'm going to ask you to do right now is more of a range of motion with your neck. Could you tilt your neck to the left and to the right and up and down? Up and down. Any pain?
No.
No? Okay, so your joints in your neck are fine, no pain, everything is symmetrical. I'm just gonna go ahead and touch you a little bit. I'm gonna feel for like lymph nodes in your armpits. There is no swollen lymph nodes here. Okay, no pain whatsoever.
No.
Good. Okay. So could you stand up for me? I'm just gonna do a quick skin inspection on you, okay?
Yep.
So your skin is nice and smooth all the way down. Oh, we can't see you, the camera can't see us, her feet, but that's okay. Fine, good. All right, go ahead and sit. Skin is nice and warm. It's intact, no open areas. Okay. So what I'm gonna do next, right now, like we're sitting like this, I am going to have you lean forward a little bit, and I'm gonna listen to your lungs.
Okay.
Okay? I'm gonna listen to lower, upper, both upper and upper. So I'm gonna listen to 4 regions in your lungs, okay? What I'm really listening for is to hear any abnormal sounds, like reels, or we call it rowls, or crackles, or wheezing, if there is any fluid in your lungs. Lean forward a little bit. Good. Could you take a deep breath? Again. Again. Go ahead. Good. One more. Excellent. One more. Brilliant. Your lungs are nice and clear.
Good.
So while I'm in the back here, what I'm gonna do is I'm gonna feel for your lung expansion. I'm gonna ask you to take a deep breath. Take a deep breath. Again. Good. So your lungs expand bilaterally evenly. So what I just did is, when we ask the patient to take a deep breath, if you take a look at my back, like when I take a deep breath and I have my fingers right here,
Yeah.
if I take a deep breath, my finger's gonna do this. So look,
Yep.
see that?
I see that.
So that's what I'm looking for. Okay, so my next thing. What I'm gonna do is I'm gonna listen to your belly. Now listening to your abdomen, I'm gonna tell you we're listening to 4 spots in your belly.
Yep.
But it's gonna be left lower, right upper, and left upper quadrant.
Okay.
Okay? Usually in the clinical settings, we do listen with the bell of the stethoscope on the skin of the patient, so you get a much accurate sound. But in this case, I'm just going to do it over your clothing.
Okay.
So you have hyperactive bowel sounds.
Is that a good thing?
It is a good thing. Lots
Okay.
of noise down there. So while I'm here, I'm going to go ahead and listen to your heart as well. I'm going to do your cardio one time. Okay?
Yep.
So when I'm listening to the heart, we have the aortic, pulmonic, Erb's point, tricuspid, mitral valve.
Okay.
I remember the mitral valve, mid-clavicle, mid-clavicular line, 5th intercostal space. Okay? So what I'm going to do now, I'm going to listen to your heart rate and beat. And I'm going to put my stethoscope, the 5th intercostal space, mid-clavicular line for 1 full minute.
Okay.
Just breathe natural. Okay, heart rate is 60, regular. Okay. So, could you stand up for me?
Yep.
So now that you're standing, the aorta will be, I'm gonna listen right here. Your femoral artery gonna be in your inner groin. I'm not gonna go there. I'm not gonna go there. All right, and your renal arteries is gonna be anywhere around here.
Okay.
Okay, all right. So while you're standing there for me, I am gonna go ahead and we're gonna do a little test. And this will be a range of motion test.
Okay.
Okay, and when we finish, then I'm gonna work on your reflexes.
Okay.
All right, I'm gonna move this chair out of the way, just like that. So what I want you to do for me, I want you to walk backward normal there for me. Now come to me. So I want you to walk on your heels backward. Could you try that?
Still want to bump into anything.
Okay, that's good there. And then you walk on your toes, come to me. Okay, so I'm gonna do kind of like a rapid reflex exercise for you. So walk back for me, just normal. And I want you to come to me, but I want you to walk like this. move one leg in, one leg out.
Like this?
Yep, one leg in, one leg out. Good. Good. Excellent. Good. I'm gonna do a little psych test here for me, like a comprehension test. So turn around. You can go ahead and sit.
Okay.
Okay. And then we're gonna do a range of motion test. We're gonna do range of motion after. So this is more like a psych NUR assessment.
Okay.
Really brief. So I'm gonna ask you to remember 4 words. You're gonna
Okay.
be cat, dog, house, and car.
Okay.
Okay? So you want to remember those for me. This will be a little comprehension test. I'm gonna give you this piece of paper and I'm gonna ask you to fold it and throw it on the ground for me. Fold it in 4, throw it on the ground, and could you pick it up for me? Great, excellent. So go back and sit. Good. All right. So let's stand up right now, and then I'm gonna do a range of motion just to check all your joints and everything, okay? All right. So could you stretch your hand out for me? Okay, let's back up a little bit. Close. That's good. That's good. Okay. No, I'll stay right here. That's good. Okay, so I'm going to do a range of motion test just to check your strength, check all your joints and everything like that, all right?
Yep.
But while you're here and your hands are out, I'm going to do a skin turgor test to make sure that you're not dehydrated. So skin turgor here, I like to pinch on the bony prominence of the patient to make sure that it go back kind of like an elastic, okay? Which is a clear indication for dehydration. Or most of the time I check the clavicle and release, okay? So could you squeeze my hands for me? Could you pull me to you? Could you push me away? Good, good, good. Could you bend your elbows? Flex them out. Could you open your fingers for me? Turn your hand over. Okay, don't let me close them. Don't let me close them. Good, good. Could you put your fist like that for me? I'm going to try and open. Good, strength. Could you fold your fist and roll your hands like that? Good. Could you do me a little exercise in motion like that? Up and down. Just up again. Straight down. Good. Do you have any problems in your joints? No problems in your joints. No problem in your elbow.
No.
No problems with your neck. Right? Okay. I'm going to go ahead and check it. Oh boy. Could you go ahead and sit really quick for me? Could you straighten this leg out?
Just one?
No, just one. Just one. Could you bend this leg? Push against my hand. Good. Could you flex your foot up like that? Good. Up and down. Good. Toes are all fine. Joints intact. Bend this leg. Push again. Good. Flex it up. Flex it down. Good. I'm going to check for edema. There is no edema. Usually check right here. No edema here. Let me see this leg. No edema. No heart problems. Any cardiac issues?
No.
Good. Put your foot up again for me. Let me check your pulse right here. Dorsal speedo. Popliteal. All the positive. Good. Bounding pulse. Good. Good. I'm going to do a little test here with this toothpick, okay?
Yep.
So you're going to tell me where you're feeling it. I want you to close your eyes.
Okay.
Could you feel that?
Yeah.
Could you feel this?
Yes.
Could you feel that?
Yeah, going down my leg,
Okay.
on my foot,
Okay.
on the bottom of my foot.
Could you feel that?
Yeah.
Good. Okay. So you have good sensation. So what I want you to do now is to close your eyes and tell me how you're feeling. Could you feel this?
Yeah. On my forehead.
On your forehead?
Yep.
Could you feel this?
On my cheek.
Good. Again?
On my going down towards my chin.
Okay. So could you tell me if this is really sharp on your forehead? Close your eyes.
Mm-hmm. No.
Okay.
No?
Good. All right. So while I'm here, I'm gonna just. I do your eyes, vision. Okay. So one of the tests after doing your head to toe assessment and your range of motion, what I could tell you is that your joints are all intact, no aches, no pains,
Right.
and you have very full range of motion.
Okay.
Okay? So, one more thing that I want to do is, I want you to stand up for me.
Sure.
So this is a test we usually do. Sometimes I see the doctors do it in a hospital. We call it a Sentinel test. We're gonna ask the client to. I don't have the chart to do it, so I'm just have to explain to you what it is.
Okay.
So we just imagine that we have. Oh, this is a picture of your dog, right?
Yep.
Okay. So we have a chart here with numbers and letters.
Okay.
And then you have how many feet that you're going to ask the patient to stand back.
Okay.
Then you ask the patient to stand back, and then you cover, and then you ask the patient to read a certain line.
Okay.
Then we determine the acuity, the vision.
Didn't you use a book
Of
with
the
some
patient.
writing on it?
No, I can't use a
Okay.
book with writings. It's had to have specific numbers and
Gotcha.
letters on it. All right.
Yep.
Okay, go ahead and sit for me again. Here, let's bring the chair up a little bit more. Okay, right here, that's better. Okay, that's better, right there. Okay. So just touch your hand and everything.
Just a little. It's wet. I don't like that kind.
Okay, so what we're gonna do right now is, I told you 4 words earlier, just to check your comprehension and your psych issues. Could you remember those 4 words I tell you earlier?
Dog,
Dog.
cat, house, car.
Excellent. Good job. All right. What else do I have to do? I did check for edema. I checked your skin turgor. I did listen to your abdomen. I tell you your femoral artery is in here. I did check your mandibular muscles, your hypoglossal, which is your tongue. So I think that's it.
Really? Okay.
Yeah.
All right.
All right. Thank you
good.
very much.
Thank you.
Okay. Great.